Sobering number released this week. Pine Rest researchers predict that Michigan could see a 32% spike in suicides, all tied to the pandemic.
Angeline McCall spoke with the experts about how they came up with that statistic. Angeline?
Pine Rest has been working on this research now for over a month, with that big takeaway being a predicted 32% increase in deaths by suicide. That number coming from research based on other epidemics that are similar, such as the 2003 SARS outbreak, as well as factors that are currently impacting people right now.
Every factor that increases suicide in our country is happening with COVID-19. So economic downturn, check. Unemployment, check. Isolation, check. Insomnia, check. Alcohol sales have skyrocketed. Substance abuse increases suicide, check. The list goes on and on and on.
Pine Rest Vice President Bob Nijkamp is worried about the future and the unknown, especially for those considered high risk, such as healthcare workers, surviving caregivers, and those who have pre-existing mental health illnesses.
Our research was really statewide. So we took the entire state's populational data to help us analyze what's needed for Michigan.
Consider this. Some suicide crisis hotlines nationwide have seen a 300% increase, according to Pine Rest. This type of data leading them to that number of an expected 2,000 deaths by suicide.
We feel this weight on our shoulders because we know that we're not prepared in the state. And but we do have time to rectify that.
Moving forward, Pine Rest believes action should be taken now to prevent suicide. The key, making behavioral health care accessible and affordable, even if it means dropping copays and offering telehealth options for those in more rural areas.
There's still a stigma for behavioral health care that's carried in our country, regretfully. But when people do access care, it works. It's evidence-based, it works. And so again, we just have to get the information out all over the state.
If you would like to access help and don't know how, the first step is to contact your general practitioner, who can point you in the right direction.
And actually, you're braver to seek care than you are to stay away from care. So that's my encouragement.
Besides contacting your doctor, another first step that you can take is calling the National Suicide Hotline. That number is currently on the bottom of your screen. You can also find more resources at fox17online.com. Reporting in Grand Rapids, Angeline McCall, Fox 17 News.